MEC, a very good evening to you. Quite a bit to discuss because your department in Limpopo is dealing with a lot currently. Let's begin with the issue of these community service doctors who were informed sometime this year that the department sadly cannot afford to keep them on because of financial problems. Why was this not detected earlier and a plan made, because you are in quite desperate need of doctors?
Evening, Tembekile, and all to your viewers at home. Probably one needs to give a background to understand that as a province, Limpopo, on an annual basis, it has been a tradition that we would, when the health professionals, I think the issue is not only medical doctors here. We need to emphasize that we've got pharmacists, nurses, radiographers, and all other allied professionals. Now, on an annual basis, they would be contracted through the statutory requirement of a 12 months for community service. So what used to happen is that upon completion of the community service, will therefore absorb them into the system as permanent employees. And what makes different between Limpopo and other provinces is that our focus was not just on those whom we have provided funding in the form of bursaries, but our argument has always been any healthcare professionals who will need in the province, and also somebody who never get a bursary from the government, who probably is having NEFSAs, having a bank loan that they need to pay. So if you don't give them that opportunity, it becomes a problem. So last year we did our own submission for us to get a treasury to approve, because what happens in Limpopo is that because of the manner in which our compensation of employees budget, I think today the Treasury MEC was telling me we are at 76%, and the highest in the province. And other province, the second, which is coming after us, is around 65%. So that tells you that you are left with 24% towards the utilization of all the cost of running of the department. That's why Treasury, I wanted to give that background. Treasury then took away powers from our departments to say, you are no longer going to appoint any employee, irrespective of whether it's a healthcare professional or it's a non-professional, because your budget continuously, you are now at 76%, which goes to salaries.
But how did it get to 76%?
Because these are historical issues that we need to deal with. We have got an elephant in the room that we have so many. Our staff establishment is probably bloated. Firstly, there is an issue of having so many people. Some of them are non-core function. And how do you do with them? These are warm bodies, and we have raised this previously when so many appointments were made, which are not your cleaners, your groundsmen, your pharmacists, your doctors, and so many admin posts, support staff. That has bloated the structure, and that's where majority of our money is going to. So you need, as government, to deal with, and also you have got to take your social partners with labor on board, because you can't just terminate people and say it's a personal issue, it's a sensitive matter. So that's what led us to be where we are today.
But you do agree that it certainly, for Limpopo's health situation, does not make sense for over 400 plus people to now not be taken into the system, given just the staff-to-patient ratio issues that you've had to deal with in the past?
It really agree with you that it really doesn't make sense to let them go. That is why early this year we did make a submission, like we'll always do, to Treasury to say we've got 146 community service doctors. That's not only bursary holder. Of course, if we were to focus on the bursary holders, we probably will be able to absorb them. But if we can't do that, because why should you divide these doctors? They are all your children. They are all South Africans. They all need employment. So we did make that submission. But Treasury says to us, you don't have money to can pay, because I'm saying to you, it's impossible for us to appoint without the approval from Treasury. So the question is, what are we currently doing to be able to do? We, as a department internally, we are looking at other ways on how can we free money, looking at our own self, so that when we go to Treasury, we should be able to say these are certain areas where we can. We're saying there are certain policies which were developed in this department. Today they might need to be reviewed. For instance, a policy on committed overtime, to say doctors in the past would be 4 in a hospital. Today they are 30 in a hospital. So do you still need to pay them that amount of group 3, which is, we are spending on overtime around 740 million. So why don't we, with our social partner, look into the matter of, we know those who are inside, because you know to trade between those who are inside, who are used to getting this particular salary, and those who are outside. side to say, how do we then look at this particular category of doctors? Do we really need them to do that group 3 overtime, or they must do group 2?
Let me ask you this then, MEC, because you said that you're not going to choose among your children from this group that you're essentially going to be laying off, if you can use that phrase. But earlier this year, your department lost a case in court against about 7 other community service doctors, where a court found that by letting them go for similar reasons, your department breached a contract that you had with these people who'd gotten bursaries from the Limpopo government and now are being told to go. So are you not opening yourself up to litigation by not at least trying to keep those?
If you follow that case, it was a case of dentists, which we went to appeal that particular case, because actual Treasury went to really appeal. Because the argument there was to say, we want to appoint this dentist. But let me give you an example, Tembekile. You find a hospital in Limpopo with 10 dentists and 2 dental chairs. There's no way a dentist can operate without a dental chair. So what is happening with the 8 dentists when you have got 2 dental chairs only? That becomes a problem. Are you employing them to come and stay at home, or do you continuously shrink that 24%, which you must buy dental chairs for those other ones that you are already having in the system? The bottom line is that in Limpopo, because we were a rural province, at that time in the past, a decision was taken. Every child of Limpopo who passed maths and science get admitted in any medical school or nursing college. We must provide them with a bursary. And that was good at that time.
Speaks to, and I don't mean to rush you, but I am being told that we need to wrap by my producer in my ear, but that speaks to the specifics of that case. What I'm asking you is, with this group, because I would imagine that from these community service doctors, not all of them are dentists who are going into perhaps over-resourced hospitals as far as dentistry is concerned. Some of them would be doing other forms of work in the hospital. So are you not opening yourself up to litigation, because you did lose the case?
That's what I'm saying. The case we appeal and another different ruling. That's why we didn't implement it. You are not getting my point. We went to appeal for the case. Actual Treasury says we have to appeal for this case because we don't have the money to appoint this one. And the case, we won the case if you follow it up. But what we are saying is that it's not about winning or losing the case. The issue here, you've got young people whom you need in the province that you need to appoint. That's why I was saying we've got to look at take painful decision, looking at overtime, including for nurses, including for EMS personnel. That's 740 million. We've got to sit with our unions and agree to say, how do we save? The other area is an area of sessional doctors. When you are having a young sessional doctors, usually we appoint them to close the gap. Now you have got young doctors who are unemployed. Do you still need a sessional doctor? A sessional doctor is a GP who's got their own practice. They do come and cover. It was relevant at that time because we didn't have unemployed doctors. So we are saying internally as a department, we've got to look at this particular area to free money and be able to appoint this one. But at the same time, we are still making an appeal to Treasury to say, look, we cannot talk about NHI without human resources. And that is why all these professionals who are out there, for me, it's my priority to say, how do we then open all these doors where anyone who wants to listen to us and be able to release money, especially those who hold the purse, we understand and hear when they say there's no money, there's no money. But the reality of the matter is that we need these professionals. And it's not only doctors, it's the pharmacists, it's all that. So what, like, for instance, if I give an example of this thing of doing overtime, to say, when you produce more radiographers, do you still need to have a radiographer to do overtime? Or you appoint one to do the day duty and another one night duty? But it also, the challenge being the current one who don't want to let go of overtime.
Okay, so we're really out of time now, but I want to squeeze in this question. In less than 20 seconds, unions have called for you to resign. They say you failed to deal with the health crisis in Limpopo, be it as far as staffing and some of the other problems. Will you resign? And would you say that the problems in Limpopo currently are way above what you are able to resolve?
I don't think the issue is that the problem of Limpopo are way above the problems of the health system in this country. The department that I've inherited, it's a department in the province where you didn't even have single specialists in many departments. Today we can talk about specialists that we are able to appoint because there's an anti-SG grant. If I'm given money, I'm able to perform.
So you're not going anywhere?
So it's not about me. I get deployed.
But they want you to go,
but
so you're not going anywhere?
I get deployed. It's my organization that will decide through my premier.
Okay, so
if they decide to say you can't perform, then I'll go.
But you are not resigning.
As it is for now, I think I still have got a task to be able to turn around the system. And if you look at the track record, the unions themselves can tell you one of the issues they are fighting about now is their performance bonuses. And ask them before my appointment, did we ever get performance bonus in the department? Not at all.
Okay.
The last time we could get was 20 million.
We are officially in trouble with my producer. I've been told to wrap 3 times already. But MEC Phophi Ramathuba, thank you so much for coming in. That was the Limpopo Health MEC Phophi Ramathuba speaking to us, I beg your pardon, about the various problems in the health department there as pertains to labour.